So we're going to be demonstrating a long leg posterior splint, and with most patients who need this kind of splint, they're going to have a pretty extensive and painful injury. So for demonstration purposes, there's just one of me, but normally you would want to find a friend who could help you support the leg. And when they're supporting the leg, they would want to grab and support underneath the ankle here, and then also maybe right underneath the knee and lift just a touch. That way you can access everything that you need to. We've already taken liberty of putting on the stockinette. It's just a lot easier to do with one person. Before we get started, we've also measured out our splinting material. For this long leg posterior, I'm going to be using 4-inch splinting material. Normally for this patient, we would be using a 3-inch orthoglass for a short leg posterior. So you may find that you have a little bit of excess material along the edges, but as long as we aren't doing anything circumferential, a little bit of excess is really no problem. We want to make sure that we pad all the way up to the gluteal fold and also down to the toes, just as you would for a short leg posterior. And when you're padding this type of splint, you want to start with a smaller web roll for the feet area. That way you get a nice good padding around the ankle. And then if you'd like, you can move up to the 4 to 6-inch web roll for the upper extremity. So we'll go ahead and start getting our 3 layers on here. Doing a quick padding here. You're going to want to consult with your doctor to see what angle they would like the ankle to be at. Oftentimes with this injury, they will have it at a 45-degree angle. It's not often that you do a long leg posterior with a 90-degree angle, but maybe in the position of comfort, but you do want to check your orders and consult with the doctor for that information. But for this demonstration, we're going to be doing about a 45-degree angle, which is just the position of comfort for this patient. When you pad, still pay attention that you're not making big wrinkles anywhere, and you definitely want to pad the heel very well, taking care not to make big dog ears here. So if you need to tear and fold the web roll as appropriate, then definitely do that. So once we've got our 3 layers on, we're going to skip ahead just a little bit. On the lower leg, you can start padding the upper leg, and this is where having a partner to help you absolutely comes in handy. And instead of wrapping around in a spiral pattern with this thicker web roll, I definitely find it's easier to tear with every pass. We're going to keep the knee slightly flexed here, so that patient is going to bend just a little bit. And they say 15 to 30 degrees is about what you want for the knee flexion, but you still want to consult with your doctor because that will vary by injury. Padding behind the knee and in front of the knee is important, but you do need to take care to ensure that you aren't creating giant wrinkles. Okay, rest. For the sake of the demonstration, we're going to assume that this was 3 layers, but because there is only one of me, we're going to go ahead and stop there with the padding, but normally you would put 3 full layers of padding on all the way up. Like I said, we had already cut our splinting material and folded in the edges. If you have a partner, you're going to want to go ahead and get the inside of this material wet. Remember not to put water on the outsides of this because it's not going to actually have much absorption, so it won't be very effective. What you want to do is just spread this splinting material in half, squirt a little bit of water in here, and then you'll work it all the way down the material until you see water dripping down the bottom. And that's when you know that you've got enough moisture in your splint to activate it. We can kind of just lay this splinting material out over the patient's leg. We're going to bring that leg up to where it will be splinted. And then we'll line the bottom of this up. This splint, like I said, we have 4-inch material here, so we're going to be careful not to create big frumpy dog ears on this ankle, but we'll get to that in just a minute. We'll use our stockinette to hold this in place. And if you need an extra hand, you can always go ahead and grab a roll of web rope and kind of secure as you work your way from distal to proximal extremity. So go ahead and grab this web roll, and we're kind of just going to give one pass of web roll over the foot here to hold it in place. And then one right around the ankle and the Achilles area. And then we'll give this ankle, we'll make the cup of our hand and kind of give this ankle a squeeze and fan that material out instead of folding it and making it dog-eared. And then we can go ahead and secure that with just a touch of web roll as well. Once we're comfortable with how our splint is placed, we're going to go ahead and start using our bias to secure it. So leaving the toes exposed, which this patient has a sock on, but normally the toes would be exposed so that we could check our CSM when we're finished. We're going to wrap from proximal to distal, so starting at the bottom of the foot and working our way up. We're not creating any wrinkles, but the purpose of this bias is just to hold our splint in place. This patient is likely not going to be doing as much moving as somebody who got a short leg posterior, but you still want to make sure that we secure this splint material all the way up. So this is where it would come especially in handy to have that partner to help us hold our material like we talked about, or hold our leg. But once we've wrapped the lower extremity with our bias, we can go ahead and grab a little bit thicker bias if we want. And we'll just do one pass over what we'd already done and then continue our way up the leg. We want to take care not to bunch too much material up behind the knee because it can create uncomfortable points of pressure. Before we finish up top, I'm just going to come around. Okay, before we finish up top, we want to make sure that we fold this stockinette over. So we have the end of our splinting material here, and then we do have some stockinette that's kind of bunched up underneath here. So we want to bring that over the splinting material. And then make sure that we don't have any major wrinkles being created underneath here. And then we can go ahead and finish wrapping our bias. And you are going to come all the way up, so make sure that the patient knows what you're doing beforehand. And then we can just finish this bias back down. Make sure that this splint is nice and secure. So if we had gotten this wet, it would have been setting up pretty quickly. Once you get one piece of tape on this, you can tape as you need to or as you would like, but you want to ensure that both the knee and the ankle are in proper splinting position for the patient. So for this patient, that's going to look like about a 15-degree flexion here, and then the ankle just in position of comfort. Once we're finished, we can go ahead and check our CSM. And that completes the long leg posterior.